We note that in the last 5 years, we have seen a declining trend in the epidemiology.
More than 12.9 million people are now receiving antiretroviral drug in lower and middle income countries, including India.
Why is Ambisome alone superior to Ambisome Plus?
What proportion of rape cases will lead to infection?
This is the first time this year, 2015, that we organize MSF Scientific Day in India. And the reason is that there is a lot of operational and medical research being done, not only by MSF, but also by other organizations, research organizations in the region.
So I presented some research from Myanmar today about adolescent HIV patients. We're seeing that there's unique ways that it's tough for HIV-infected teenagers, and so being able to come to scientific days in India and share with other MSF programs in the South Asian and Southeast Asian region and other partners that are from this area as well, perhaps they can learn from this and they can look at their own teenagers and their own HIV-infected adolescents.
When you disseminate some of your own study findings, you are inviting either more questions on your work, or accepting your work, or criticism on your work. And when you have been seeing all those different facets, then you look for widening your research base. So I think organizing this type of scientific meeting is the best way to disseminate what you have been doing.
I think we have increasingly realized the potential that exists in this region. I think there's a vibrant scientific community here. I think evidence and our experience from the field needs to be shared and to be conveyed and used as a tool for advocacy and for change.
The live streaming means that people who are participating in Scientific Day in London can see and hear what's happening live in Delhi and vice versa.
Though we are calling it a scientific conference, our goal is very different. We are covering mainly the presentation of the marginalized areas, marginalized people, and who are not getting the best of everything. Let your research reach to these communities. Let your research be more humanitarian.
There's a good networking between people, between academic institutions, between scientists and people who are working for MSF, which I think there will be a long-lasting relationship among all these.
When we talk of a scientific day for the MSF, it is with renewed vigor that the MSF joins hands with other partners in this fight against disease.